Yeah, I'm Alyssa Tilhou. I am an assistant professor in family medicine at Boston University Boston Medical Center. And if my name sounds familiar, it's because I was a fellow at UW till April 2021. You can tell I'm now a professor at BU because I'm wearing a blazer in my updated headshot. Here's our accreditation statement. I have no disclosures, and I am talking today about fentanyl test strips, and they're used as a harm reduction tool in preventing overdose. As a result of speaking today, I am hoping that you all will be able to explain what fentanyl test strips are and how to use them, to analyze the evidence suggesting benefits of use, to list the evidence gaps, to understand their applications and their limitations, and then to explain the logistics for where and how to get them. So, fentanyl test strips are a tool that let people check their drugs for the presence of fentanyl in select analogs. They are pictured here. These little sticks on the left, where you see one line is positive for fentanyl and two is negative. If they look like those COVID rapid tests that you have stockpiled at home, it's because they're very similar. This is an immunoassay with antibodies embedded in the strip that reacts to antigens in the substance. Um, Such as fentanyl or an analog. They are designed for use in a liquid substance. And recently, over the past few years, harm reduction organizations have been increasingly distributing these sticks or strips to clients in the hopes that testing drugs can help people mitigate their risk of overdose by changing behavior when they know their substance is positive for fentanyl. This is important because, as you probably know, the continuing rising rate of opioid overdose it has in large part due to synthetic opioids like fentanyl. So, harm reduction refers to interventions that are aimed at reducing the negative effects of health behaviors without necessarily extinguishing the problematic health behaviors. In other words, we're uncoupling the behavior of drug use from the harms of drug use as an overdose. And this is important because not everybody who uses substances wants to stop or is ready to stop. And as we know from Alyssa's presentation, many people who want to stop and feel ready to stop still have trouble stopping use. So this is a tool where we can try and minimize harms no matter where someone is on that change trajectory. Some pictures of well-known harm reduction tools: sterile supplies in the top left, Narcan on the bottom left, those test strips in the top right, and then on the bottom right, a picture of an overdose prevention center where people can use their substance under the supervision of trained personnel who can help reverse an overdose if one were to occur. So, fentanyl test strips have been compared to the gold standard of spectrometers. And interestingly, they have been shown, compared to these two very well respected, legitimate spectrometer brands or companies here, that they actually have a lower fentanyl detection limit and they're more sensitive and more specific, and they can actually recognize more analogs. The caveat is that fentanyl test strips only provide a qualitative yes or no. Is there fentanyl or an analog present? And by yes, no, I really mean, is there a substance, fentanyl or an analog, at the concentration level of detection or above, where the spectrometers can actually give more detailed information about the concentration. So a positive on a test strip does not indicate strength, concentration, quantity of the substance it has found. So here's a rapid overview of the evidence. In survey research, people who use drugs find fentanyl test strips very acceptable as an intervention. In other words, they feel that they're easy to use, both in the logistics of actually using the strip and incorporating it into their behaviors, and that it provides desirable information. And then there are a number of studies now that show that fentanyl test strip use is associated with some safety behaviors. For example, using less of a substance, pushing the drug more slowly, snorting instead of injecting, doing a test dose, using test strips to avoid fentanyl, using test strips and then finding it's positive and discarding the substance you have, using with someone else, or making sure you have naloxone nearby before you use. The caveat to all this research is that the studies are pretty much exclusively cross-sectional. So this is not causal evidence that test strip use produces behavior changes or just behaviors in general that are associated with a reduction in overdose risk. along the same lines, these are some more caveats. There's no causal evidence that test strip use impacts overdose rates. And just like test strips can be used to find drugs without fentanyl, they can be used to find drugs with fentanyl. There's also a question of how do these test strips actually get used in communities and drug markets that are very highly saturated with fentanyl adulteration. So if the person is going to get a positive after a positive, will it still have the same effect on their behaviors? And there is some qualitative research that suggests that yes, fentanyl test strips can still be helpful. People who use them, even in markets highly saturated with fentanyl, find that they can talk in a new way to suppliers or to peers about fentanyl in the drugs, that they find some emotional reassurance and a reduction in anxiety just from seeing a confirmed positive on the strip, and that some people find it affirms their safety behaviors that they were going to use perhaps, but now feel doubly sure it was important. And some people do actually try to avoid drugs with fentanyl. And so even in markets where there's a lot of fentanyl. There is variable effectiveness for identifying analogs, and that's both across strip brands and then also from analog to analog. You also might realize that a large number of strips would be needed if you were really to test your drugs every time you use. Many patients that we work with who use drugs use once a day, if not 2, 3, 4 times a day. And so if you actually are testing all of the substance that you're using, that's a lot of strips. There is some risk of a false positive. So specifically with MDMA and methamphetamine, there's a high risk of false positive, and I'll talk more about testing those substances soon. If a substance is adulterated or caught with diphenhydramine or ascorbic acid, there's also a higher chance of a false positive. Certainly a false negative is riskier, scarier in terms of overdose. So there's the chocolate chip cookie effect. Imagine somebody has a hard drug substance, like a rock, and they're testing just a chip off the edge. It doesn't mean that fentanyl isn't somewhere else embedded in the substance that they have. There are also variable detection limits from analog to analog, and that there can still be fentanyl below the detection limit of the strip. And then certainly as novel analogs emerge on the market, the fentanyl test strips that we have may not be able to detect them. So this is a list on the right of the analogs that are deemed to be detectable by one of the most common strips out there, this rapid response strip from BTNX. If people know of other strips or are familiar with other strips, it would be great if people can put that information in the chat. This is the most commonly used one that I know of. And so I'm going to be talking a lot about this one in particular because we just know the most about it. And so on the right, you'll see the list of analogs and their detection limits. And so fentanyl can be detected at a limit of 20 nanograms per mil at the lowest. But if you look all the way down to sufentanil, you need a concentration of 100,000 nanograms per mil. So that's a very big difference. And the impact of this really varies along with the potency of the analog. So for example, acetylfentanyl, detected at a limit of 150 nanograms per mil, but it's only a third the potency of fentanyl, where in contrast, carfentanil, you require 1,000 nanograms per mil to be detected in the substance, but its potency can be as high as 100 times more potent than fentanyl. And then there's company data I'm showing here versus unbiased lab tested data versus what actually happens in real life. And so I've got this citation at the bottom, a study by Berg and colleagues, and they actually tested the sensitivity of 4 different brands of fentanyl test strips to finding analogs. And they all were able to find quite a high number of analogs. I will let you pull up that study yourself at risk of sounding like I'm leaning towards one company over another. I'm not. And there's just the question of what is actually available, I think, to your community and what's available to the patients that you're working with. The other question is what happens in real life. So this citation by Green and colleagues, they actually tested seized samples in Providence and Baltimore. And this is the same study that compared the fentanyl test strips to the spectrometers that I showed earlier. And very interestingly, the fentanyl test strips actually perform better in identifying analogs, acetylfentanyl and furanylfentanyl specifically. The spectrometers didn't identify that they were in the substance. So I think what's in some ways is curious is we don't actually know if there were other analogs in those seized samples because what we thought was our best technology didn't find them. And then this is specifically again about the BTNX strips, and there's actually less data about some of the other companies out there. So logistics, again, this Berg study tested these 4 strips shown here in blue, but people can actually get a variety of strips on the internet. You can just order them online. They tend to be about $1 each. And so again, if you're thinking about how often someone uses, this can be quite a pricey endeavor and require a lot of supplies. So I am next going to show you directions for how to use these strips from many different sources. And I'm going to do that because I want you to have a general gist of how they're used for when you're speaking with patients or clients, but also just to underscore how much we don't yet know, I think, about using test strips effectively and correctly, because there's a lot of variation. And when patients or clients find information about how to use them, there isn't necessarily clarity on what strip is being referenced in the directions that are searchable on the internet. So I'm starting with this these directions from Vivent Health. And for those who don't know, Vivent is an HIV prevention and treatment organization in Wisconsin. They also have sites in Colorado and Texas. They do awesome work. They have a program called LifePoint that distributes sterile supplies, education, Narcan, and test strips to people who use drugs as a harm reduction program within their organization. And so this is the little, they have like a little strip of paper with these directions that they give out to clients when they distribute test strips. And so this is specifically for someone who's going to inject. You prepare your shot as you normally would in an unused cooker. You then load your syringe and set it aside. What is left in the cooker is a residue, to which you add a 1/4 inch of sterile water, and then you insert your strip, wait, and read the strip. Really straightforward, clear directions with the caveats that we've discussed about detection limits and analogs. Again, this is for someone who is injecting, and so you are really only testing the substance you're about to inject, which means whatever is left in the baggie or the container that they were going to use, you don't know if there is fentanyl or an analog in there. In contrast, here are some directions from anypositivechange.org and Chicago Recovery Alliance. And so on the right, Any Positive Change says use a grain of salt amount and mix it into 30 mils of water, which I think, I can picture a shot glass size, but I'm not sure I could guess what 30 mils inside that, that thick clear glass that you might see actually looks like in a different kind of vessel. So I think there's some trickiness there. And then Chicago Recovery Alliance, they say a tiny amount of powder or crushed drug into your cooker. But this picture here, number 2, it looks a whole lot more than a grain of salt. Again, just variability in how organizations are recommending that people use these. This is from Cook County, and they say a very small amount of powder. Here is a little picture of a grain of rice, but they actually say put it in a half-filled shot glass. And again, these were for directions for people who are going to inject, and so you're testing as you go. But that chocolate chip cookie effect, you might want to know if your whole supply has any fentanyl. And so actually from New York City Health, they recommend dissolving all of the drugs you plan to use in water. That way, if it's positive, you know that the whole supply you have is positive, or if it's negative, the whole supply you have is negative. And then they say in this yellow down here, you can then drink them, snort them, or wait for the water to evaporate. And so while this might be the safest, it's a little bit impractical for most people. Option 2, crush all of the drugs you have, put them in a baggie. This is this red circle here. Shake the baggie, empty the baggie, put those drugs in a different bag or a different container. And now you have a residue, ideally from the whole sample in that first bag, to which you can add your water. Again, this question of how much water to add, since you're not in a cooker that perhaps has a more constant size. What does it mean to add here a half teaspoon of water? For meth, MDMA, ecstasy, they actually say 1 full teaspoon of water for a very specific 10 milligrams of crystal. So whether people can implement this in the right way, I think really varies from person to person. Here are some directions from South Carolina. They have a very similar set of directions on the left as the New York City Health, where you can use 2 baggies, for example. You crush in one, transfer to another, and then add a little bit of water. But then in contrast with the half teaspoon on the prior slide, they then say add another half cup of water. So there's just a lot of variation out there in what people are recommended to do. And so I come back to Vyvanse directions because I think for people who inject, this is very clear and it's very replicable that you prepare your shot and then add a quarter inch of water. Um, for testing stimulants for MDMA and methamphetamine, there is no consensus, even more so on the best way to reduce a false positive. The chances of a false positive are particularly high for these substances, and so the recommendation is to dilute the residue much more than you would for other drugs, up to even a half cup of water. And remember, don't use a shard. You really want to make sure everything is crushed into a powder. So a few comments on legal issues. There previously was a restriction on using federal funds to purchase strips that was lifted by SAMHSA in April. However, many states still consider fentanyl test strips paraphernalia. And actually, as of today, we think the bill has passed to remove this designation, which is great. And maybe we can talk about that here in a minute when I'm all done. I got like one more slide. Vyvanse is still the only source in Wisconsin distributing test strips, but now that this designation of paraphernalia has changed, that does potentially open doors for other options. So finally, talking to patients about this, it's really hard to implement test strip use when someone is withdrawing and feeling really sick. It's hard to do if you don't have enough strips, your supply is low, if you don't have a safe space to test, or if you're feeling really down or hopeless about life in general. And so, things you can do as providers are counsel patients on planning ahead, thinking about where you use, where you plan to use next. Can you structure your life a little bit more so that you have strips on hand and are using in a place that is easier to test in? Reminding people there's no amount that's safe and to always have naloxone. So some brief conclusions. Test strips are a harm reduction strategy that may be associated with safer behaviors, but we don't know for sure if they impact overdose rates. How to test stimulants is particularly unclear, and regardless, there's no guarantee about analogs. And this slide was outdated because I finished these up, and now as of today, perhaps the legislation has changed for this last bullet point about paraphernalia. So any questions? Thanks, everybody.